Hey guys, Tony Maritato here, licensed physical therapist, and I want to geek out with you for a minute talking about stretching, range of motion, talking about different tissue types. Because I think it's important, I think it's helpful that if you're trying to increase range of motion, whether it be into extension or into flexion for your total knee replacement, if you understand how the different kinds of tissue function, you might be able to improve the quality of the time you spend stretching different tissue. So we're going to just generically talk about 4 kinds of tissue. We're going to talk about muscle. Now, muscle is very elastic. I've got a rubber band. The rubber band stretches a long distance with a relatively low amount of force. This is what a typical muscle might be like. You can stretch muscle very easily. There's very little to low resistance if the muscle is relaxed. But when you contract the muscle, when you tighten the muscle, so if I try to pull my hand to my face and I resist that motion, the bicep muscle is going to get really tight. It's going to get hard. It's almost going to go from like a rubbery mass to a solid. That is an important component because when I'm just stretching a muscle, I want the muscle to be relaxed. But if I want to transfer that stretch to the tendon is the white connective tissue that attaches a muscle to a bone. I want the muscle to be tight so that I can transfer the force to the tendon. Now, tendon is a lot like a rope. So a rope is thicker than a rubber band. It's more fibrous than a rubber band. It will have some stretch, but not nearly as much stretch as the rubber band has. And the stretch on a rope will require a longer duration and much higher loads. So if I was trying to stretch the tendon component, I would want the muscle to be tight and I want it to apply that pull against the tendon. The third structure is the ligament. The ligament is much like a tendon. It's thick, it's fibrous, it's white because it doesn't have a rich blood supply. We don't generally want to stretch aggressively ligaments because ligaments provide stability to a joint. When my muscle isn't working, I need the ligaments to hold the joint together. So typically we're not stretching ligaments, and the most common ligaments after a knee replacement that somebody might be referencing are the lateral collateral ligaments. They're not going to limit your range of motion anyway, so there isn't really a time that you're stretching those ligaments. The final component that we're going to talk about is the scar tissue. So the scar tissue is kind of this combination. It is generally has a poor vascular supply. It's not very rich in blood and blood vessels. It's more fibrous. It's more white. It's more like a ligament or a tendon kind of matrix. And what we believe from clinical research is that when your body is producing scar tissue, it kind of lays it down in this haphazard fashion. So a muscle is nice, long, skinny cells. Connective tissue and ligaments and tendons, the cells tend to follow that same kind of long spaghetti strand matrix, but scar tissue tends to just lay down in almost like a cobweb fashion. When we apply a stress, when we pull on the scar tissue, it starts to help those fibers to realign. And that's what we're trying to achieve. Now, just like tendon, if I want to stretch scar tissue, I need to first kind of get a sense for where the scar tissue is. I need to put the joint in positions that optimize the force transfer to the main target where the scar tissue is. And I need to apply a long duration, lower intensity force stretch to the scar tissue to allow those fibers to realign, to allow what we call creep, which is a physics term essentially that allows the tissue to elongate. And what we're trying to do is, I don't know that I would necessarily use the terminology that we're breaking scar tissue, but we're reorganizing the scar tissue, just like the example I usually give is when I'm building a callus. Now it's springtime here, I'm raking, I'm shoveling, I'm digging out weeds. If I do too much too quick, I develop a blister. But if I do it slowly and consistently, I will develop a callus. The skin will thicken, it'll become tough, it'll grow in size. That's essentially what we want to do to condition the scar tissue to allow it to rearrange, to organize in a different fashion that will allow increased mobility, but still provide the intention of the scar tissue, which is allowing the incision to heal, allowing the connective tissue to come together and provide stability for the tissue that's been disrupted during the surgery. So we usually vilify scar tissue as a bad thing because it limits range of motion. It may potentially contribute to some of the pain that we're experiencing. But we have to understand that without scar tissue, we can't heal. So it's a necessary component of the healing process. But hopefully, if you better understand how to target specific positions and motions that apply the right force and the right intensity for the right amount of time to the restricted area around the joint, you will get improvement. And that's where it really comes down to, educating yourself, finding a physical therapist that can spend the time with you to really kind of dive into where are your deficiencies, where are your deficits, how are we going to target those in a way that'll allow you to experience improvement as quickly as possible and as painlessly as possible. If you have more questions, please consider posting them in the comments below this video. Join my Facebook group, the Total Knee Replacement Support Group for Kind People. And if you want to watch another one of my videos, go ahead and click on this thumbnail right here. This is what YouTube's recommending you watch next. I will catch you guys on the next video.